Hello, this is Dr. Douglas Scarata, and we just want to thank you for watching over the patient this evening. Being a care provider is a responsibility, and you may be a spouse, you may feel like you have no choice, you may be a family member, you may be a friend, but it doesn't matter to us. We're just grateful that you're there to help, and we want to make it really easy for you to succeed. So we're going to walk you through a few steps here to make sure you have all the information you need. First handout, if you want the best, be the best. You need to read all of this information we're going to go through here. You need to supervise your patient while they're under the influence of these medications. You need to be with them so that if they have a problem or a question, you're there to help out. And you really want to help them to stay relaxed. If they're getting agitated or upset, do what you can to relax them. There is an extra relaxation pill called clonidine, and you could consider using that if you think they could use a good night's sleep. Okay, the next two handouts are the post-procedure instructions. Take a few minutes and read through this. It's important. It'll answer many of the questions that will occur, and you'll feel comfortable and ready to take care of what comes your way this evening. And the second handout, some additional post-procedure instructions. Okay, these next two are two of the most important, probably the two most important handouts. I really want you to take your time and go through here. If you have a nosebleed, which luckily for us happens infrequently, this is exactly what you need to know. And you don't want to be reading it for the first time when people feel panicky. You want to be strong when you feel weak. You want to be brave when you feel scared. And this will enable you to do it. Step one, you need to understand what's happening. Step two, you have to follow this strategy because it really does work. Stay calm. The rule of threes is a great trick. You can use this in other ways in your life. You want to do what you can to decrease the blood pressure and decrease the heart rate. You want to apply pressure. Use a cold wash rag, so have one prepared. And consider clonidine. We talked about that already once. The second part of this handout, if the bleeding continues, you want to consider doing the nasal irrigation. Even if you've had a septoplasty, you can do that. And the Afrin Soak cotton balls often are not wedged in well enough, and that's all you need to do. And if bleeding still continues, or for whatever reason you feel like you need more help, we are here to help you out. So make sure you read through these, and you write down any questions you may have, or let us know, and we'll go over that with you before you leave. Finally, since you're going to be overseeing the recovery of your loved one, understand how the nose heals. It'll answer so many questions. There's goal number one. We want to achieve physiologic nasal airflow. We actually have a video on this. So if you go to our YouTube channel and type in physiologic nasal airflow, or if you just, go to our website, we've got a video library there. You can watch it. You can see that is one of our main goals for all of our patients. And the second goal is to preserve or to return what we call mucociliary clearance. And go ahead and read through this. I'm not going to read it out loud. Then it's also important to keep in mind there's two phases to healing. The first phase of healing is nasal congestion. So the nose will get congested as it heals over the first 7 days to 14 days. It gets progressively swollen on the inside, and then it decreases. The outside will look totally fine, but your loved one will feel nasal congestion, normal. Second phase of healing is clearing the secretions. So as the time goes on, they'll be able to remove more and more material from their nose. Some of it's old crusty material, which is actually the infection being pushed out of the sinuses. So don't be concerned with that. That's not another infection. It might even feel like an infection because you're in the process of pushing that bacteria out of your nose. And in doing so, you experience all the normal symptoms you would experience with exposing bacteria to the normal lining of your nose. So don't be concerned with that. If the temperature gets above 101.5, that's when we get worried. And I can't remember the last time that happened. Post-procedure appointments you'll have at intervals, and we will look in your nose with a nasal endoscope the first time. We may need to subsequently, because we'll put you on different clinical pathways, and this talks about that. And always remember, we are here for you. We're always here for you. So please make sure you call and ask questions if you need to. This handout here we're perhaps most proud of, our frequently asked questions. It will only take you a few minutes. I would guess less than 5 minutes to read through each of these. And these questions represent all the best questions we've been asked over the years. And every so often, someone will ask a question that we haven't heard yet. If we think it's a good question that many other people might want to know, we add it to the list. Folks, we haven't had to add a question for over 3 months, over 4 or 5 months probably. So it's pretty complete. If you read through this, you'll know so much more. Good morning. So it's Monday morning for me here at the Modern Nose Clinic. Everyone's waking up, showing up to work. And I just thought I'd do a brief video on things to think about that first night, because we do get some questions over and over again, and I want to reassure people more than anything else. Also give you an idea of when to worry and when you don't have to worry. The way we do your surgery is unique, and we're doing it that way so to maximize the healing process, to minimize the pain, minimize narcotics. One of the trade-offs that we have to make, I'm trying not to bump my head again if you saw the other video. Okay, I didn't do it. One of the trade-offs that we made is that we cause as little tissue damage as possible, and we have to accept that there's going to be some dripping, some bleeding from your nose for the first evening. As I may have mentioned during your surgery, the nose is beautiful. It's an amazing thing. I love it. That's what we do. Modern Nose Clinic, nose all day long, and I love it. Great job. It's got lots of little tiny fingers that we call cilia, and I think I've mentioned before, and they beat along like this. They're very important, and I think they've been underappreciated for years in our field. We have many surgeries in ear, nose, and throat where you destroy lots of tissue. You cut out the inferior turbinate. You do surgery in the OR where you cut away lots of tissue. I believe that a lot of that tissue is supposed to be there and it's serving a function. For one thing, the skin with the cilia are beating away to move mucus, secretions, dirt, dust into basically the garbage compactor. So when we have the option of cauterizing tissue to stop bleeding or to let it drip over the evening, we have made the decision that we'll let it drip. We think that that's a better trade-off. Therefore, there's less tissue trauma, and therefore the tissue heals faster, believe it or not. You just need not to be too anxious or worried, because I know it's kind of scary. Oh, look, there's some blood coming out of my nose. Normal. So last weekend, for instance, we did about, 4 surgeries on Friday, and one of the patients called up because those little cotton balls that you put in your nose were saturating with blood. We completely expect that. If they saturate with blood, that would be normal, not something to worry about. What you want to look for, which is the real question, is when do I worry? When do I call you up? You can call me up anytime you have a question or a problem, but you don't need to worry unless the drip pad under your nose. That's what we're going to focus on. So the drip pad under your nose, you'll take one 4x4, you'll put it on top of the other 4x4, you'll take it, and you're going to fold it 4 times. How about that? 4, 4, 4. That was just an accident. We didn't even do it on purpose. It doesn't have to be exactly, but roughly 4 times. So you get somewhat of a tight structure, about the width of the blue drip pad. You'll then put it, now this is going to be a trick because I only have like 2 arms and one arm is holding my thing. Put it under your nose, and then you'll put this little holder around it, and you place it, and you can set a timer at that point in time. And the question is, how long is it until the front part of that nasal drip pad has saturated all the way through? So you see a whole bunch of red in the front, not just a little dot, but it's saturated through. If that occurs in 15 minutes or shorter, you need to call me. We're gonna have to do something, and I'll meet you at the office. We'll take care of it, no big deal. But if it's saturating through much less than that, then I would say that's within normal limits. And for those caregivers watching this video and wondering what to worry about, it doesn't really hurt the patient. You don't want to make them anxious. So reassure them. If you call me on the phone, I'll probably suggest put a cool compress over the face, keep the head elevated, do not lay down flat, play some music or put on the TV, just relax. Do what you can so they keep their blood pressure down, their heart rate down. Because the higher your blood pressure gets because you're anxious, because maybe your caregiver feels anxious and it's contagious, well then your heart goes a little bit faster, your blood pressure is a little bit higher, and you're just going to drip a little bit more. So those other things are better to reassure them and tell them it's going to be okay, by tomorrow it'll stop. If you'd like, you can put those icy cold cotton balls in your nose, as we've talked about. I think that's not a bad idea. You can insert them as deeply as you feel comfortable doing. You just have to be able to retrieve them, so don't put them so deep you can't grab them back out. Tweezers are helpful with that. Some people put 2 in each side. If you hadn't had a septoplasty, If Dr. Scarata and the team, me, and the team say that it's okay to rinse your nose, the irrigation's helpful. Sometimes an icy cold irrigation that evening will help to wash away old blood clots. The blood clots there, maybe it's not even actively bleeding, it's just slowly dripping out the front of your nose. That does happen. That'll happen the following day. So the rinse bottle's awesome for that. So that's another clue. I don't get a whole lot of other questions other than the bleeding, but sometimes I'll get questions about, a person feeling nauseated. I really don't like narcotics personally. I don't think you have to take them after the surgery. I don't think they speed the healing process at all. I prefer ibuprofen, Tylenol, or a combination of the two. But if you choose to take a narcotic, you must do so with food in your stomach. If you do it on an empty stomach, it'll cause problems. Some antibiotics, you should really drink a lot of water after you take the antibiotic, like clindamycin, for instance. Don't do a dry swallow. Swallow it and then drink lots of water. Having food in your stomach is always easier for your body to digest medications. Again, with the narcotic, some people will actually crush the narcotic and put it under the tongue and just absorb it in that manner. That'll bypass the stomach altogether. These are just some clues. Sometimes I get questions about, a couple days after the surgery, my nose feels congested. That is the healing process, and everybody heals differently. If there was some magic way I could do it where no one ever had congestion and they immediately felt better, that would be awesome. But your nose is about to go through the healing process. We saved as much tissue as possible. The old way I used to do this surgery, where you cut out so much tissue, there'd be a giant tunnel through your nose, you would notice the increased airflow sooner. But this more modern, more delicate, more sophisticated surgery, it takes a little bit of time for the swelling to come down. And as it does, however, you're going to notice a difference. I'm sure of that. And your nose will be functioning correctly, filtering out dirt, dust, etc. So you really did a good decision. Congratulations. Surgery's over. Sweet. And you can sleep tonight feeling reassured that it's normal to have some dripping and nasal congestion. Keep the head elevated. Start your rinse bottle the following day. Okay, so my name is Doug Scarata at the Modern Nose Clinic, and we typically use this product here, and I thought it might be useful for those of you who might have a procedure with us, or those of you who aren't even our patients, to understand how I recommend using it. It might be of interest. So of all the pictures on this box, the only picture I find of any use is this one. And this is a picture of a lady irrigating her nose. There's three things about this picture we find to be useful. One is that her head should be parallel with the countertop, so she's looking straight down at the drain in the sink. Number two, the bottle should be directed directly up, going perpendicular to the orientation of your head. So it will enter one nostril and the gravity will take it down the other nostril. And three, you need to be exhaling out your mouth while you're squirting in through your nose. I find it to be helpful to watch me do a demonstration, which will be, if not helpful, at least entertaining. Here you go. Thank you very much. So this is a bottle, so suspend your disbelief. Unscrew the lid, one packet of powder, fill it up with water that you consider to be safe, shake it up, and you might say, Dr. Scarata, doesn't it go like this while I look at the mirror? I mean, my nose goes like that. And I would say, no, that's completely wrong. You want to be looking straight down at the drain. You want this to be going straight up, so it's perpendicular. You want to be breathing out your mouth while you squirt in through your nose, like this. Three or four squirts, and you'll be done the entire bottle. Put another packet of powder in, fill it up with water, safe water, shake it up, do the other side, same thing. Do an entire bottle on the right, do an entire bottle on the left in the morning, do an entire bottle on the right, do an entire bottle on the left in the evening. If you'd like, you can do it multiple times a day. Think of it like washing your hands for your nose. During those first 2 weeks after surgery, it's really important to keep your nose moist so you can maximize the healing process. Extra pearls. What's happening is that there's a salty fluid sitting on the swollen tissue, and the salt in that irrigation is now drawing fluid out of the lining of your nose called mucosa, and therefore it will start to open the sinuses and the nasal passageway. That's why if you did 2 packets That would make it even more concentrated, might work better. Another thing that could be a better idea than 2 packets is just to do more rinse bottles. So you can do them as often as you like. People will say, oh, then 15-20 minutes later, fluid will come out. True that. What you could do is go into what I call praying position, which I'll try to show you here. Tilt your head forward. If you don't have any religious or spiritual belief, then just think of something positive, like I'm gonna have a great day, I'm gonna have a great day, whatever. I'm highly organized, I'm a happy person, whatever. Tell yourself that about 10 times. Or you could pray. And as you're in that position, the remainder of the water will drip out on its own. So that's a little pearl you might try. All right, let me see if I can demonstrate. This is really effective and it's really inexpensive. And I hope this is, this is freaking entertaining. There better be someone out there who likes this video or I'm never doing this again. All right, guys, signing off, Dr. Douglas Scarata, Modern Nose Clinic. We know your nose. Good morning. This is Doug Scarata, Modern Nose Clinic, and we're going to talk about post-operatively what's happening inside your nose. I'm going to try to walk backwards and not bump into a door. So we both have interesting things to see on this video, don't we? Ow. Anyway, so you survived the surgery. Congratulations. I knew you could do it. A lot of things are happening inside your nose and they happen to everybody. And so we thought this video might be informative so people are reassured as they notice the symptoms they're experiencing. Well, a couple of things are working against you. First of all, you've had infection for at least 3 months, or you've had infection repeatedly over several years. So inside your nose, there's specialized skin. We call it mucosa. And the mucosa has little tiny fingers that we call cilia, and they beat one direction. They're very important. They're like the janitorial service, cleaning your nose out every day. Remember, your nose is designed to collect dirt, dust, pathogens, viral particles, bacteria, fungus, and eliminate it in a very organized manner. So it's continuously filtering all of the dirt and dust in the environment as we're trying to deliver physiologic airflow, another video if you'd like to watch it, and we're trying to have maximally conditioned air reaching the back of your nose and going into your throat. So the cilia form a very important part of that. They move a layer of mucus along a predetermined pathway through your nose. And those cilia go to sleep because of the infection and or the surgery. And in our experience, for most healthy people, they start to wake up between 1 week and 3 weeks following the surgery. As they wake up, what happens is the scabs, the mucus, the blood, and the infection that's been there for a long time starts to get mobilized. You absolutely have to do your nasal rinse bottle. For some reason that I don't understand, some of you patients have decided it's not that important. It is. You should be doing a minimum of 4 bottles a day. 1 bottle on the right side, 1 bottle on the left side in the morning, 1 bottle on the right side, and 1 bottle on the left side in the evening. If you'd like to do it more often, that's fine. Looks like my glasses are always crooked, doesn't it? Anyway. I have never had to look at my ugly mug as much as I have had to making these videos because I'm doing these selfies and I'm looking at myself talk and it's kind of weird. Anyway, so they're waking up and you're gonna have cold-like symptoms. Yes, you'll have congestion. Yes, you're gonna have decreased sense of smell. That's all normal. You might even feel tired because if you think about it, your body is diverting energy towards the healing process. So normally you'll have excess energy each day for discretionary activities, but now a certain percentage of that energy is being diverted towards the healing process. So it's normal to feel tired, have a runny nose, nasal congestion, but don't worry, that all goes away. It all goes away just like me, because we're done this video, and now I'm gonna try not to hit my head again. Okay, thank you, take care. Thank you for surviving the surgery, and thank you for surviving this video. Please feel free to check out the other video content brought to you by the Modern Nose Clinic.